2 cases of fatalities. But how would your kind of method help people identify that?
Well, what we're proposing here is you have your clinical trials data right now, and what we're trying to do is provide information around drug safety. And as you know, in the last 10 years, Neil, there's been over 300 drugs that have been introduced into the marketplace. Millions of patients have taken these drugs. We're talking about, after the drug has been introduced, to be able to have a vehicle that could provide, if you will, quick understanding of the safety signals of pharmaceuticals. And that's really what the I3 Imperial Drug Registry is all about.
Could I ask you this, Donato? I'm going to ask a couple
Sure.
of ignorant questions, but I ask many of these, so here's one. Sure. Would your type of method have been able to identify Vioxx as a problem for Merck?
Well, I think it's very important to understand what's available today. We have MedWatch data, we have the clinical trials data, which you had alluded to here a few minutes ago. What we're talking about is speed. We're talking about expediting, if you will, the kind of information that can allow the regulators and pharmaceutical companies to make quick decisions about the relative risk of pharmaceuticals. So ultimately, we're providing information and doing it at a speed that is far greater than what has been done before.
But in this environment, Donato, is it not true that the business itself, let's say, or Merck, or the FDA itself, that supervises a Merck, is going to be leery of getting a speedy decision on almost any drug, right?
Well, you know, when you look at the majority of drugs that are on the market, Neil, the majority of the drugs are safe when they're followed according to label. What we are trying to do is to really provide the kind of information that can be expedited, that can help the FDA, that can help the pharmaceutical companies make quick decisions around the safety of drugs. Our clients will be the pharmaceutical manufacturers, it will be the regulators, it will be anyone.
But aren't they farming what they do out to you in so doing?
I'm sorry?
Aren't they farming out to you the research, the clinical data and all of that out to you? It's stuff that they've been doing up to now on their own.
Well, on this particular product, we have the information via the United Health Group, which is our parent company. We have claims on 11 million lives. And I think that's really the benefit here. We have 11 million lives. We have claims data. We process 1 million claims a day, 30 million claims a month. This information is coming together. What we're doing now is parlaying that with the technology, with the science, and being able to make this information available almost as near to real time as you can get it. And we believe that that's going to provide for a better and more safer drug environment.
All right. Sorry for jumping the gun there. Donato Tramuto, thank you very much. I3 Magnifi CEO. Appreciate it, sir.
Thank you very much.
Well, it is hot. It's